Hello, everyone. My name is Victoria Lasky. My pronouns are she, her, and I am the Associate Director of Safety Net Licensing at the Behavioral Health Administration. And I am going to talk to you a little bit today about our rules and rulemaking that will be coming up soon. So state agencies like the Behavioral Health Administration, or BHA, have the authority to make rules. The BHA has three different types of rules: provider rules, administrative rules, and commissioner rules. What I'm going to be talking about today are the provider rules. We have 15 chapters of rules that will be governing behavioral health providers in the state of Colorado. We have those chapters of rule available on our Laws and Rules webpage, which we will make sure that you have the link to so that you can take a look at these rules as you are able. We have the authority to license and designate certain types of providers at the BHA. So there are many different types of providers that cannot provide services or cannot receive reimbursement or payment for services without a license or a certain type of designation. So one of these types of licenses in the state of Colorado is the Behavioral Health Entity License, or the BHE. So back in 2019, there was a law passed that created the BHE license. And essentially the goal for that was to make sure that people that were receiving services from behavioral health providers had the same types of protections as people receiving services from physical health providers. So this license type was created. It is currently with the Colorado Department of Public Health and Environment, or CDPHE, which does a lot of other types of health facility licensing in Colorado. Currently, the BHE license only includes mental health providers. That was sort of thought of as phase 1 of the BHE. Phase 2 of the BHE will happen when the Behavioral Health Administration has the authority to do these licenses. So it will be moving completely from the health department to the BHA, and substance use disorder treatment providers will also be included in the license type when that happens. So because the BHA will be getting this authority soon, that means that we have to write rules about what this license is, what providers need to do to get this license, and all different types of requirements to ensure high quality services and that the health, safety, and welfare of individuals receiving services is protected. So just for some information about what is a BHE, what type of provider would get this kind of license. These include providers that provide mental health and or substance use disorder services, which may include things like outpatient therapy, whether that's individual sessions or group sessions, residential services. So if you need to stay overnight for treatment for a behavioral health condition, crisis services, including walk-in centers and crisis stabilization units, criminal justice affiliated providers, such as those that provide treatment or education for driving under the influence charges, or DUI providers, are all different types of services or provider types that may need to get a behavioral health entity license. And these rules speak to the requirements that they have to meet in order to get this license. So that includes things like staffing requirements. You know, how many staff do you have to have on site at an overnight facility? This includes building safety. This includes the rights of individuals receiving services, how your information can be shared, how you can access your own records, different types of protections for the staff. What type of training do staff need to receive? Treatment frequency and services per level of care. If you're in residential treatment, how many hours of treatment do you receive per week? Also, how to apply for a license, what happens if the provider is not following the rules. So we set out these rules, and if a provider is not following them, the BHA may require a corrective action plan, telling us how they are going to fix that rule violation, up to and including revocation in serious cases where there's a serious threat to health, safety, and welfare of individuals served. So that is the kind of very high level idea of what is in the rules, what you can expect to see there, and how those rules can protect individuals receiving services. So that is one license type at the BHA. The BHA also has a couple of other license types that I won't talk about today, but we'll be talking with you about in the coming months when we are going to be revamping those rules. But I also wanted to mention the 2765 designation, which is a very jargony term and essentially means these are providers that provide services to people who are these are involuntary services. So these are folks who are on a certification. So we currently have this designation for providers who are providing involuntary services that is currently in our rules. We are needing to revise these and update them because there was a law passed in 2022, so last year, that really increased the rights of individuals who are receiving these involuntary services. So we need to make sure that our rules are really speaking to that new legislation and making sure that those individuals receiving involuntary services are given all of those appropriate protections and rights. And so we are putting forth, that is chapter 15, about those types of services and providers as well. I am now going to pass it on over to Erica, who's going to talk a little bit about our safety net provider approval.
Thanks, Victoria. My name is Erica Gannett, and I'm going to talk a little bit about the behavioral health safety net providers today. I'm a safety net licensing manager here at the BHA. So chapters 3 and 4 address safety net specific rules. And in chapter 3, we talk about provider approval and the requirements for different behavioral health safety net providers. So the behavioral health safety net describes the behavioral health services that are available across the state to meet the behavioral health needs of all Coloradans. And the safety net is comprised of essential behavioral health safety net providers and comprehensive community behavioral health providers. And this safety net is really designed to ensure that individuals are not turned away without the care or support that they need to reach whole person wellness. So a key element of the safety net is ensuring that individuals can access services regardless of who they are or the complexity of their needs. These behavioral health safety net providers will have the expertise and will be required to serve individuals regardless of an individual's ability to pay, their place of residence, disability, age, race, creed, color, sex, sexual orientation, gender identity and expression, national origin, or tribal affiliation. The safety net will be required to serve an individual regardless of their involvement with the criminal or juvenile justice system or child welfare systems, regardless of co-occurring diagnoses they may have, including mental health and substance use disorders, physical, intellectual, or developmental disabilities, or support they may need with daily living. And they're also required to serve individuals regardless of displays of aggressive behavior or history of aggressive behavior that may exist as a symptom of their diagnosed behavioral health disorders. So behavioral health safety net providers will also be providing care coordination services to ensure that individuals are connected to the supports they need to address concerns related to not only their behavioral health, but also their physical health or other needs they may have, like housing or food insecurity. And this care coordination will happen in conjunction with the BHA, existing RAIs, and in the future, behavioral health administrative service organizations. Chapter 3 outlines the specific requirements of behavioral health safety net providers, and also the process for them to be approved and how we review to ensure that they are providing person-centered, culturally competent care that reaches and meets the needs of all Coloradans. In Chapter 4, there are rules for care management. And care management, it will be a service that some behavioral health safety net providers will be providing. And it's more intensive support related to ensuring that individuals receive the support they need to manage complex needs related to more severe behavioral health diagnoses and other factors that may influence an individual's ability to achieve whole person health. So care management involves care coordination activities like those I mentioned before, ensuring an individual is connected to other providers and services, but it also involves more intensive support, more frequent contact, intentional and scheduled communication and collaboration with an individual's team or support systems, and helping an individual to learn skills related to self-advocacy and self-management of their diagnoses and other needs they may have. Care management may also include outreach to individuals who need extra support to continue pursuing their treatment goals, may have missed appointments, and may benefit from additional support to stay engaged in services. So those requirements are specific to the safety net providers that are being built out as part of the system and in conjunction with the rules for BHEs in 2765 that Victoria addressed.